So, a drug is just a substance other than food that, when taken into the body, alters the function by either acting on cells, tissues, or organs. So, by that definition, all supplements are, of course, drugs. Today, I was going to give you guys a video about a specific supplement because you guys have been asking for that. But honestly, I realized I can't do that until I give you a broader overview of my own philosophy on supplements first. So in today's video, we are going to talk about supplements, and we are going to define the fact that a supplement is just another kind of drug. We're going to review what distinguishes a supplement from a prescription drug. We will bust some common myths about supplements that could cost you. We will also discuss the many benefits of some supplements and how I use them in my own practice, because I absolutely do. And then we'll review how to choose and then use supplements in a safe and effective way. Hi, if you guys are new here, I am Dr. Lily Johnston. I'm a board certified vascular surgeon, but I also specialize in cardiometabolic prevention so that you never need me as a surgeon. So a drug is just a substance other than food that, when taken into the body, alters the function by either acting on cells, tissues, or organs. So by that definition, all supplements are, of course, drugs. Now, the question in your mind is, well, what distinguishes then a supplement from a prescription drug? And that has lots of legislation behind it. But for the purposes of this conversation, let's say that it's predominantly a legal and a marketing distinction. So drugs are sold for the purpose of treating, curing, or preventing a specific disease. They are allowed to say that in all of their advertising, like you see on all those commercials. But a supplement cannot actually be advertised to treat anything. It is only to support, quote unquote, normal function. So you'll see sleep support, energy, immune function, but there is no, or there should be, no claim about the efficacy of a supplement to treat a specific indication. And the next big hurdle is that there has to be evidence for a prescription drug to be sold on the market. The FDA requires, prior to sale, that every major pharmaceutical has both proof of safety and of efficacy. Now, we can quibble about how good those data are and whether we believe them, but nevertheless, there have to be some submissions for safety and efficacy prior to a drug getting approved and then sold on the market. A supplement requires neither of those things. There is no burden of proof whatsoever that a supplement must be safe or effective for anything before it comes to market. The only safety monitoring that is done for supplements is what we call post-market, meaning if there are multiple reports of somebody having a bad reaction, then people will investigate and take a look and see what's going on. But otherwise, there is no routine monitoring for safety of supplements. This is all regulated from a piece of legislation in 1994 called the Dietary Supplement Health and Education Act. And we'll talk more about that in a little bit. Let's think about the manufacturing of drugs versus supplements. Drugs are required to have very tight control of the manufacturing. The dosages must be within a certain percentage of the specified amount. There are inspections, there will be recalls, and there is a mandatory adverse event or side effect reporting system. Guess what exists about that for supplements? None of it. There's no controls on the manufacture or monitoring of supplements in the industry. So the supplement thing is really just a scout's honor. That's, it is what we say it is in the bottle, and the dose is what we say it is, and it's safe. We promise. Scout's honor. So, all of this is to say supplements are a little bit of the Wild West. You don't always know what you're going to get. And there are still great things about supplements, and I do use them in my practice, but I use them in a very targeted way to address a specific problem with a measurable outcome. And we will come back to that in the last part as we talk about how I like to think about supplementation and how I recommend you guys to think about it as well. Let's talk about just a few of the myths that come to my mind immediately when I think about the supplement industry that I want you guys to know. We do not have time to talk about all of them, and there are many. And if you guys have more that you want to talk about or that you've heard, please drop them down in the comments below. But let's start with myth number one, which is that the supplement industry is more altruistic or more noble than Big Pharma. And this is completely a myth, because in 2025, the supplement industry was valued at $203 billion worldwide. And well over a third of that was spent in the United States alone. So make no mistake, this is a business. They don't want you well any more than this Big Pharma wants you well. They don't want you well, they want you worried. Okay. Now, the difference is where that money gets spent, because in pharma, you know that a huge amount of the dollars are spent on research and development and then the testing, right? I told you that we have to have proof of safety and efficacy before a drug can be approved. Well, the supplement folks don't have to worry about that. The vast majority of the money they spend is on marketing and customer acquisition. Big supplement industry also has a big lobby, just like Big Pharma, and they lobby to restrict additional oversight. You'll remember that bill we talked about, the 1994 Act. The lobby groups will work hard to ensure that very little additional regulation is put in place to restrict the supplement industry. And many people think that the individual supplement brands are, their own kind of little mom and pop shop, but they belong and are owned by big conglomerates just like food brands. So Nestle owns Pure Encapsulations. Procter & Gamble has their own supplement company. So all of this to say, this is major, major business. And it is not altruistic. If people are doing a good job in the supplement industry, it's because that's a core value of them and their business. But I wouldn't take that for granted across the board. The next big myth I want to talk about is, well, if there's so little regulation, that probably means that it's not that harmful. Things are probably overall pretty safe, right? Like they wouldn't just let really dangerous things go out in the world without that kind of, supervision or regulation. That's not true either. So in the last month, I have seen at least 2 recalls of supplements from the FDA because those supplements actually contain prescription drug ingredients that they were not supposed to or allowed to have. And when I did a search to confirm this, there was a third one that came up, also recalled for having a prescription ingredient in it that should not be allowed in those supplements. The next part of this is that supplements account for 20% or 1 in 5 of cases of drug-induced liver injury. So this is when the liver is poisoned by substances that come in through the body, right? And a lot of times those are medications with that as a known side effect, so people are monitoring and watching for it. But if you're just taking a supplement, you might not know that that's even a possibility. And the symptoms, the red flags kind of go unnoticed by you until it's really late. And this translates into 20% of drug-induced liver failure being caused by supplements. And this is rapidly rising. This is not steady. We are seeing a 2 to 3-fold increase in cases of drug-induced liver injury related to these supplements. And I'll tell you a story really quick. When I was a resident in general surgery, I was on the transplant service and I was asked to go see a patient as a consultation for a possible liver transplant evaluation. Most of the patients I had seen on that service were men and women in their 50s and 60s who either had hepatitis as the cause of their liver failure or maybe alcoholism in the past that they were in recovery from. And that's kind of what I was expecting when I walked into the patient's room. And I was knocked on my ass because this was a young woman. She was in her 20s and she was in liver failure because of a weight loss supplement. That's what her family said, that she had bought a supplement online to try to lose weight. And it had put her in the hospital. She was on a ventilator. She couldn't even talk to me. And I was blown away because that could be me, right? Like we are all susceptible to these quick fixes and we want an easy answer. And it was a very stark recognition that these things have real consequences. So don't for a second believe that just because they're minimally regulated and available over the counter, that they can't cause harm. The last myth I'm going to cover quickly is, well, okay, sure, there may be some bad actors out there, right? I get it. But I get my supplements from Kirkland. I get them from CVS. I get them from Amazon. Surely those are safe, right? Not quite. In 2024, CVS faced a recall rate on their generic drugs and their supplements that was about twice the average of their partners. When they first started testing supplements in 2019, 7% of what was on the shelf at CVS failed and had to be pulled off the shelf. And a Consumer Reports investigation found that Kirkland brand fish oil failed a disintegration test, meaning that the capsule didn't actually dissolve the way that it was supposed to. So it might be safe, but it's not necessarily functional. So you're just wasting money if the supplement isn't doing what you think it's going to do. And then, Amazon in 2024 had a policy that they created requiring third-party lab testing for all of its supplements. But a 2025 investigative report by Supco found that over 50% of best-selling supplements purchased on Amazon failed to meet the active ingredient label claims. Half failed the active ingredient label claims. And in many cases, there were 0 to 3% of the advertised ingredient in those supplements. So no, just because you get them at Kirkland or CVS or Amazon or any other big box store does not mean that your supplements are safe. We will talk in a couple of minutes about how to look and get the best information about how your supplement has been tested and whether it's certified. All right. Now that I've scared you to death, I'm sorry. I'm not a total Scrooge, right? There are some really great things about supplements, and I promise to tell you, I use them in my practice. So let's go over a few of the benefits that I think supplements really provide. And the first is that some things that I use are only available as a supplement. I couldn't prescribe them if I wanted to. So this includes things like creatine, magnesium glycinate, vitamin D3 and K2, methylated B vitamins. I use a supplement in my vein patients called MPFF. That's not available as a prescription. So there are absolutely very useful compounds that I think are evidence-based and appropriate, but there's no other way to give them other than as a supplement. So in those scenarios, absolutely, I do recommend supplementation, and I help my patients find the best and safest source for those supplements. The next big benefit to supplements is that access is much more democratic and it's a lot faster. So for those of you who are getting your medical degree from doctors on the internet, or who don't have a physician with the time or the knowledge to help you with some of these prevention issues that we talk about all the time on this channel, supplements do allow you to have some control without the need for a prescription. Again, that comes with some responsibility, and we'll talk about that later in the video. But the other component to this is that when new compounds show promise, and I'm thinking of things like K2 with nattokinase, they can be rapidly scaled and brought to market. Again, we don't have safety testing or any efficacy testing, but it is a faster path to allow some potentially helpful compounds to come to market and for us to have access to them both as patients and as clinicians. I think the most compelling reason that people prefer supplements to drugs is that being sick is a bad thing. Nobody wants to be sick, and drugs are for sick people. Supplements are for wellness. They're for vitality and longevity. And I just want you to remember how much money the supplement industry spends on marketing to make you feel this way. But it's a very, very powerful motivator, this idea that we aren't treating a disease, we are just supporting normal function, and therefore we are well. We are not sick people taking drugs. I think that that's an artificial distinction, but it's really powerful for a huge number of people, and I'm susceptible to that too. The last really great benefit of supplements is for those patients who, for whatever reason, cannot or will not take prescription drugs, it is just one more tool in the toolbox that I have to help people try to prevent disease or stay off of my operating table, because many of these supplements, although they don't have the same evidence base as the prescription drugs that I prescribe, they do have a lot of promise behind them and a lot of reason to believe that they may have a positive impact on my patients. So it gives me something to do if drugs are not on the table. I think it's my obligation to be careful, to monitor them, and to treat them like the drugs that they are. But if prescriptions are not an option, at least we can go with supplements. So let's talk about how to do this the right way. Let's start with just an example of the wrong way. I had a patient who came to me about 6 months ago, and she came with a milk crate full of bottles of pills. And she was like, "Doc, I'm not sure exactly what all these are or what they do, but I've been taking all of them. And can we go through it?" And we spent at least half of her appointment with me going through bottle by bottle of milk thistle and L-theanine and ashwagandha and all kinds of supplements that she had. And she didn't know why she was taking them. It's not to say that they might not be effective for a particular thing, but she read somewhere that it was a good idea to take it and she thought she should, so she did. And she just kept buying supplement after supplement and taking them. And I know where that comes from, right? This is the marketing dollars that are keeping people worried. But let's be thoughtful about this. So the way to do this right is to treat it like a drug, and that means we have an indication. What problem are we trying to solve? Is it a lab value? Is it a symptom that we're having? Let's be clear and let's use a targeted intervention to address that problem. The second part of this, are there any other tools like lifestyle that would do it as well or better than a supplement? Supplements are not the easy button that get us out of good nutrition, of movement, of optimizing our sleep and our stress. Now, they can help with those things, but they can't do the hard work and the heavy lifting of those lifestyle interventions for us. Next is evaluating the evidence. Why do we believe that this particular supplement is going to help do what we think it's going to do? What are the studies? Have they been done in humans, or are we just looking at some, immortal rats, right? If animal studies were the be all and end all, we would have cured cancer decades ago. We have cured cancer 1,000 times in mice and still not been able to make those translate into human results. So it's important that we have human trial data and that the humans in those trials look like you, right? That we are representing the right person in these studies. Do we have any efficacy data, right? We may move a biomarker like LDL cholesterol, but do we know anything about whether that translated into improved mortality down the road? I don't know. Let's see what the evidence says. And I think the last thing is to make sure that supplements are a reasonable thing. So if I'm doing it, of course, as a doctor, I'm going to be doing this checklist and making sure that my patient is an appropriate patient for supplements. But for you, let's see if there are some reasons that you should just stop thinking about supplements right now altogether. So are you pregnant, trying to become pregnant? Are you breastfeeding? Bad time to start some supplements. Do you have kidney or liver disease that might get worse by supplements? Do you have a history of abnormal heart rhythms or fainting that could be made worse? How about any blood thinning agents or antiplatelet agents? Do you have immunosuppression, like for an autoimmune disease? Any psych medications like SSRIs, SNRIs, MAO inhibitors, lithium, all of these things, right? All of these supplements can impact the levels of other drugs in our system. And if you meet any of those criteria, I want you to stop thinking about treating yourself and go talk to your doctor before you do any of these supplements. The next step to this is making sure that you have the highest quality supplement you can get. So that means that there has been third-party testing, not just of like the weight of the capsule, but also the active ingredient, potentially looking for any contaminants. And the optimal way is to get something that is certified. So USP will certify supplements, and probably the highest bar is the NSF certified for sport. This not only means that what's in the capsule or tablet actually is what the label says, but also that they don't contain any banned substances for athletes. And that's probably the highest certification that exists. And we'll show you what that certification looks like. We will also put a link to the website where you can look up to see if your supplements have been NSF for sport certified. I think certification is by far and away the best way to make sure that whatever supplement you're taking has been evaluated by somebody who does not have a vested interest in selling that supplement to you, to make sure that it is what it says it is. I like to avoid anything that shows a proprietary blend on a supplement. So you will see this in, like energy support. Well, it'll have a proprietary blend of like 20 different ingredients. If I don't know what's in it, nobody can test to see what's in it. And that makes me very nervous. So I try to avoid anything with a proprietary blend. We talk a lot about what are the best brands for supplements. Well, there are several, and we can discuss that. But just because the brand is a high quality brand doesn't mean that if you get it on Amazon, it's not counterfeit, right? You can get all kinds of counterfeit things through Amazon. It's easy enough to print that label, copy the logo, and have what looks like a Thorne supplement actually be a knockoff. So if you are buying high quality brands, please buy them either direct from the manufacturer or from a trusted clearinghouse. The highest risk categories of supplements for either drug-induced liver injury or for recalls, having pharmaceutical ingredients that they're not supposed to have. First, weight loss or fat burners. Those are pretty high risk. Any detox or cleanse, anything that is labeled for sexual enhancement. At least one of those recalls that we talked about from last month was one of those. And then anything in the energy, like pre-workout, stimulants, or nootropics, which is not exactly energy, but that's a separate category. All of those are highly likely to have either some proprietary blend or either a dangerous ingredient that may cause harm. And the last step in a safe and conscientious supplementation protocol is to verify that your supplement is doing what you want it to do. So if we were looking at a lab marker, has that improved? So I use methylated B complex vitamins to manage elevated homocysteine. Well, great, you better believe that in 3 to 4 months, I am checking another homocysteine level to make sure that it's coming down. I will also be checking liver function tests just to make sure that we don't have any unwanted side effects from that supplementation. Never seen that from homocysteine, but it's never a bad idea to check. So verify that your supplement is doing what it's supposed to do. If it's a symptom, make sure that your symptom is getting better. Keep a diary. Okay, so my hope is that if you have a secret milk crate full of supplements, you have now got a better perspective on how you might tailor that for the very specific things that you need to accomplish with your supplementation, and that you have a plan for how to go get a certified, safe, high quality supplement for those things you are going to manage with supplements. And, I thought long and hard about how to help you guys do this in a safe and responsible way, because there are a lot of doctors out there who are shilling their own supplements, and I don't have a beef with that, but it's not really how I want this channel to run or how I want my business to run. And I need to provide you guys a place to go that has safe, high quality supplements, because you're going to do it anyway, whether I tell you it's a good idea or not. So we are going to put up the website that I use. It is called Fullscript. They are a clearinghouse for major supplement brands, including the very high quality ones that I use, like Pure Encapsulations, Thorne, Metagenics, and many others. If you want to go there and get yourself some supplements, again, double check the certification, the third-party testing. I really like that Fullscript has done enhanced testing for many of the supplements that they sell. They show you that with a little icon. It's a little brown shield that says enhanced testing, and they have sent those samples out, again, for additional third-party testing to confirm what is in the pill is what it says on the label. And I think that that's a great way to do it. All of those supplements come either direct from the manufacturer or from a controlled warehouse. So it is not counterfeit. It is what you think you should be getting. In the description below, you guys will also find an affiliate link for the Fullscript website. That will give you a 10% off discount, but most importantly, it does support this channel. So just in the sake of full transparency, you are welcome to go to the regular Fullscript website and do that without the affiliate link. There is also that affiliate link in the description with a 10% off coupon for you, and it's my way of saying thank you for supporting the channel if you choose to do so. With that, let me know if you found this video helpful. If this was helpful, please gently tap that like button, subscribe to the channel, share it with somebody who needs to hear it. And all of that really helps us continue to grow and get this message out to more people. I appreciate you guys. Until next time, take really good care.